everybody. It's Dr. Jonathan Valinga. I don't know that I've met all of you, but I'm new to the practice here at TCIM, started this summer. And just doing a little bit of a video to talk about kind of a timely issue as we head into winter and flu season. But what I was asked to talk about briefly was colds and viruses and why maybe taking antibiotics is not a good idea for that, and trying to sort out that whole issue. I know it's always a kind of a tough question. There certainly are benefits to antibiotics, and they can be a life-saving intervention when used appropriately for the right infection. But the truth is that most of the infections that cycle through communities in the winter are in fact caused by viruses. We know about the flu, that's influenza virus. There's also cold viruses like rhinovirus and other viruses like adenovirus and Coxsackie virus that commonly cause sinusitis or ear infections or bronchitis. And sometimes it's difficult to kind of sort out what's going on and how to treat these things and what the appropriate treatment is. I think most of us understand that antibiotics only treat bacterial infections, which can also cause ear infections and sinus infections and lung infections, though those usually cause pneumonia, which can be very different from bronchitis, which is more typically caused by viruses. So how do we sort all this out so that we don't use antibiotics inappropriately, is what I wanted to talk briefly about. Generally, respiratory infections are caused by viruses. The common cold usually causes a runny nose, sneezy, sore throat scenario and lasts 3 to 5 days. But some viral infections can actually cause sinusitis, which a lot of people typically, historically, have presumed that's a bacterial infection that always needs antibiotics. But there have been good studies done showing that aspirates from sinus mucus during sinus infections over 90% of the time grows viruses and not bacteria. And so quite often treating sinus infections with antibiotics is not always the right thing to do. Bronchitis is a very common infection that people frequently take antibiotics for unnecessarily. Bronchitis is typically presented as a deep sore throat that progresses down into the lungs, where you have a deep chest cough that can be quite incessant, and the cough can last for up to 3 to 6 weeks. So these things can last a long time. Generally, with viral bronchitis, patients don't feel very sick. They don't run high fevers. They just have this nagging, long-lasting cough that can be really frustrating and make it hard to work and make it hard to sleep. But the vast majority of bronchitis, if you do a bronchoscopy and actually culture the sputum in the bronchial tubes, shows that these are caused by viruses. So over 90% of the time, acute bronchitis is caused by viruses. So I think red flags to kind of help people sort out when they need to be checked out or consider antibiotics or consider a better workup would be anytime you have, you're more than a week into an infection and things seem to be getting worse and not slowly better, is a good time to get checked out. Anytime you have high-grade temperatures, which is a fever over 100.5, that's a good reason to be looked at. If you have sinus pain or pressure or ear pain or pressure that seems to be worsening after a week, that's a good time to consider being checked out, period. So shortness of breath, I should say as well, that's another one. If you have a lung infection or bronchitis and seem to be getting worse and more short of breath, that's a very important vital sign to get checked out with. So fevers typically are going to occur in more serious sinus infections. Pneumonia will often cause fevers. Influenza can often cause fevers. And influenza is one of these viruses that can be life-threatening. And it's important, I think, to get evaluated when you have that to see if antivirals would be a good treatment at that point, or to make sure that you're safe to be writing out an infection like that at home. So that's kind of how I separate those in general terms. Of course, if you're worried that you're not sure what's going on, you can't quite sort this out on your own, it's always safe to get looked at. But one of the main things we want to avoid, right, is using antibiotics for viral infections. Because first of all, it won't help at all, it won't make any difference. Antibiotics will not kill viruses or speed up your recovery in any way. And the growing list of downsides to using antibiotics is getting longer and longer. We're starting to understand some important caveats to using antibiotics inappropriately that I don't think we fully understood initially. I think the dialogue around using antibiotics inappropriately has mainly been centered on, creating resistant bacteria if we use too many antibiotics, and now we have these superbugs that can't be treated. And that is still a very valid concern with using antibiotics. We don't want to create resistant bugs. We don't want to have these in our bodies should we ever need to be treated, and now we don't have a good agent to kill a life-threatening infection. And so that's still very valid, but what we're starting to understand more and more is what a detrimental effect that antibiotics have on our microbiome. And what that is the healthy bacteria that live in and on our body. We have good bacteria that help us in many ways, that cover our skin and are important to skin health, that colonize our nose and our sinus tracts and our throat and our lungs, and especially bacteria that colonize our gastrointestinal tract. When you take a broad-spectrum antibiotic, it will wipe out the vast majority of your flora in your body, and sometimes these important strains of bacteria that are critical to our health are gone from our body at that point, never to return. It's very hard to reestablish healthy flora after it's gone, and a single course of broad-spectrum antibiotics can remove some of these helpful species and strains of bacteria permanently. Probiotics are often used to reestablish flora in the gastrointestinal tract, and can be a helpful and useful tool, but probiotic strains are quite limited. It's very hard to create a probiotic that has the same kind of diversity that the natural microbiome has. Most people who have never taken antibiotics have 300 to 500 strains of bacteria living in their gut, and most probiotics have maybe anywhere from 5 to maybe 30 strains at the very most. And so we don't really come close to compensating for a normal human microbiome by taking probiotics, though it can be very useful. And what we've seen over time is that the more diverse your microbiome in your gut is, the more healthy people are in general. And there are a host of problems that can come from an inadequate diversity of bacteria in the colon. A lot of people who have too many bad bacteria residing in their colon and not enough of the healthy sort end up getting intestinal inflammation, intestinal permeability, excessive amounts of unhealthy bacteria, sometimes excessive amounts of yeast, sometimes parasites. And as inflammation kind of grows in the intestines and damage happens there, this can be a source of inflammation that can affect the whole body. A lot of people have chronic fatigue and chronic brain fog and skin problems, and one of the most worrisome disorders is sometimes the development of autoimmune diseases that now has been linked to a history of recurrent antibiotic use and poor intestinal flora and chronic intestinal inflammation have all been shown to be a causative factor in autoimmune diseases. So it's an interesting growing body of research, but we're starting to understand that sometimes the toll that antibiotics can take on our body can be far-reaching and have a lot of difficult future implications. So I don't want to discourage antibiotic use when it's necessary. Antibiotics have saved many, many lives. But if used inappropriately too many times, combined with the right type of constitution or genetics, this could lead to some pretty serious problems down the road that are much worse, in my opinion, than the potential for resistant strains of bacteria. So I think it's important to sort this out, and if you're not sure what's going on with you this flu season, we'd be happy to see you to try and make sure you get the right treatment. There are ways to deal with viruses and treat viral infections that can really help. And certain viruses we have actually some pretty good treatments for. So either way, we can direct you the best way to go and help you to avoid some of these untoward effects of antibiotics. So please come see us if you're having any problems this winter, and I hope this video helps you kind of sort out what can be a pretty murky issue for a lot of people. Grateful to have you as patients, and I hope to meet you all soon. Thank you. Bye.